Great day, wonderful people. My name is Mr. Stanley. Here we want to take you through psychology of pain in health psychology. Okay, without wasting time, let's get started. Trying to define definition of pain from International Association for the Study of Pain. It's sensory and emotional negative experience induced by or related with real or imagined tissues, lesions, or described in terms that refer to such lesions. All right. That's what is trying to project something that is more sensory or more related to emotional negative experience. That is not a nice experience. Okay. Some of the components of pain may rally behind physiological, which are more like physical aspects that we feel, receptors, pathways, body pain, and something related to that. Behavioral, those are some of those gestures and mimics that we portray that accompany pain, and then some subjective aspects which goes to thoughts, feelings, or as well as the way we perceive pain as well. It's also very important. Now looking at the classification of pain, I believe there are quite like two aspects that we can classify pain. At the current moment in time, we can use acute pain and chronic pain. So acute pain is morely between like 6 weeks and 6 months in its lifespan and associated with anxiety, which are quite what do you call it, a signal for life threat, which also cause anxiety, as well as some of the aspects which are profound, like muscle, membrane, internal organs that are felt when it comes to that pain, as well as intense or less intense, as well as the patient or the client is described with a burning sensation, pressure, pulling or tearing. It depends now with the type of pain. I mean, with the type of the injury or of the tissue involved as well. Looking at chronic pain, which lasts more than 6 months, located mostly in internal organs associated with sensation of compression, distress for the patient and family. Something like in relation like cancer can also be part and parcel of chronic pain as well. These are of high intense as well with recurring episodes with what they call pain-free intervals as well as a migraine. So these are pain which last more than 6 months, isn't it? And also mostly in the internal organs. So the intensity and also increasing constantly. For example, like arthritis, cancer, as we have mentioned previously. So there are quite a number of theories which explain about cancer. Which explain about theories of pain. Looking at Weddell, 1962, mentioned something, what they call non-specific model. Weddell, in summary, explained that there are no specific pathways of perception for pain. Like pain occurs through intense stimulations of non-specific receptors. Like our pain is not coming from specific object or a specific center, or it's just come in a random sense. That's why he pointed it at non-specific model, specifically as well as a Von Trey specificity. This one now looks at the specific stimuli for specific receptors and specific pathways of transmission. For a very good example, pressure, skin, as well as we may say noise, sensations, which causes pain, ears, is for example, in some of those aspects. Okay, looking at gate control theory by Melzack and Wall, 1965. Looking at this theory in current modern times, it explained that neural mechanisms located, stimulus are transmitted or they are blocked, isn't it? So the gate closes or a pain is not transmitted when fiber A are not related to pain are then stimulated. So these stimuli have priority, isn't it? So the gate is closed and then none are related, stimuli which are non-related with pain are then the ones which gets to be stimulated. So the gate is opened. Now, activities of fibers of A and C. So these fibers are more like specific pathways for pain stimuli. So very intense pain may be felt, and that information interpreted is very painful, which means the gate is opened. So that is what the gate control theory of pain. So also there are feelings of anxiety, sadness, which are also experienced, depression associated with the stimuli. Uh, Psychosocial factors which are also related to perception of pain, sex as well. So the difference with the sex as well as sexual hormones, which influence development among individuals, as well as genetic differences between sexes, which also influence that. Then comes with age. Age also influences the older or the younger, and depends on the situation and how you felt the pain. Either it's a psychological pain or it's more like physical, induced by social events. And also difference in personalities. Difference in personalities also influence pain perception in another sense. So introverts, they look, they are more reactive to pain, and they are said to have lower pain threshold. Then subject with also negative beliefs linked with potential painful events tend to overrepresent the pain. Subject to negative beliefs, too much thinking or being much of thoughtful in terms of aspects. And then also subject to the history of abuse in childhood development. It's also another aspect for pain-prone personalities, and also inability for verbally express negative feelings as well. Some cannot express that issue of like remaining quiet. It's also allowed to express your feelings verbally, but just control your expressions. As well as past experiences of pain. Probably you couldn't manage properly pain, or you felt the pain is extreme. The moment you hear information, it makes you feel more and more uncomfortable. And then as sources of information, family or a doctor, when they tell you about what is to come, it also influences the way you perceive pain. All right. Now, acute pain also is influenced also by coping styles of the subject. Uh, is it emotional centered, as well as also, is it morely like problem centered? Emotional centered, distracting attention from pain, it also works very much better, as well as problem centered, information gathering, it also works better. Distract yourself from pain, it also very good trying to do other activities. Now, problem centered, looking for information on how to counter painful situations, as well as a therapist as well. Emotional empathy, relational abilities, where the therapist assists one to work well. So chronic pain is more influenced by also the significance. Am I going to die? And also the meaning of pain, that it's life-threatening, as well as it's sharp, as well as individual affective states, anxiety, depression, hostility, also enhance pain perception. If one is in depressive conditions, negative affect as well influences how we process information. When we're not feeling well, when we are bored, angry, or sad, it also influences the way we process information, which leads to negative perception of pain as well, which makes us to perceive pain more painful, as well as cognitive style. What they say, catastrophic thinking, for example, this means I'm going to die. It also influences the way we view pain or the way we feel pain. Over representation of pain, it also affects, as well as negative expectations that we are going to expect, probably surgery that is 1, 2, 3 is going to be removed, while when religious beliefs as well as the story goes on, also influences the way we perceive pain. Some of the psychological management of pain are relaxation techniques, as well as to reduce reliance on drugs is also because it also increases addiction and dependence. So relaxation techniques are progressive muscle relaxation, as well as some relaxation techniques which works well with stress as well, since stress and anxiety is very much involved prior and also pre and post exposure to pain as well. Uh, so they also say stress is found as the significant predictor of the intensity of pain. How deeper the pain is going to be also get explained by how the person gets affected by knowing how much is he or she is going to feel, as well as different responses to stress also influences how we experience pain to some extent as well. So stress can also reduce reliance on several coping techniques. Distraction can also work well, as well as other counter aspects. Some they say hypnosis 15 to 30% can be able to be hypnotized. So among the 15%, as well as some they say there's little evidence about its efficiency in terms of, or little of scientific evidence, if I may say so, in terms of how hypnosis can work. Behavioral aspects also aims to reduce disability, as well as focusing on pain behaviors, excessive resting, so that the body rests and rejuvenates itself. And then as well work on assumptions that pain behaviors are reinforced, as well as looking at care, sympathy, positive reinforcement as well as avoiding unpleasant events, which is a negative reinforcement. And also treatment may consist of identifying stimuli, behaviors, and reinforcers in terms of how we can handle pain, reduction of reinforcement in terms of relation to pain behaviors, increase more of well behaviors in terms of social behaviors or social reinforcement. Cognitive treatments, morely, cognitive restructuring, focusing on appraisal, proper expectations, as well as beliefs about origins and consequences needs to be looked into. So catastrophic beliefs needs to be restructured so that one tends to find control over the pain. Redefinition of the pain as well to create or to make it look less negative. Also improving the mood, reconceptualize the problem, restructure the problem so that it viewed quite manageable. Everything can be managed to a certain extent. It depends with the experience or whatever is going, whatever one is going through. That's what I may say in terms of managing. Education or information is always needed. Find information according to our ability of understanding, so that you can gather enough and understand the nature of pain, as well as can give you room for you to have control over it. Exercise, find activities to take your brain away, sleep management programs where you control your sleep or where you get enough rest, as well as change beliefs, work on that, as well as other dysfunctional symptoms one have to work towards, isn't it? So that's one of the aspects in relation to pain perception. Any other question one can throw below in the discussion forum or under comment section. You have a wonderful time.